when these came out, they were hot. They were the in thing, but as you saw, the size and the different ideas simplified and became more diminished. Now they're down to this level. This is really common, like with ski patrol, okay, and then also military medics carry these as opposed to these in general. Okay, so this one's called the HAIR. Can't remember what that acronym stands for, but basically the idea is that it can be adjusted. Let's go ahead and take the shoe off. It can be adjusted to position function to varying length lines. Okay, so you can see how this can adjust. Oh, I know what's going on. It's a little bit too tight. Okay, so you can see how that slides, and then based on the length, then we have some locks. So right up here underneath the butt cheek, basically right where John pointed out, where the hip bone is attached to the pelvic girdle, this pad is where it's going to rest at that length. So we're going to align it. So we're going to be working around each other, because again, we've got one person pulling manual traction, the other person manual stabilization. Okay. So keep your foot at position of function. And so the length needs to be adjusted about 8 to 10 inches past the foot. Okay? 8 to 10 inches is the distance. Then we have these locks here. To lock it into position. Okay. So this has a common component of all these devices, to include the broomsticks down there. Those, I'm going to show you the improvised devices. Okay. So, the ankle hitch is an important component of all of them. And the location for the ankle hitch is just above the malleoli of the tibia and the fibula, because it's going to be secure around the ankle, and then once the manual traction takes place, this is going to pull in and then rest against the malleoli. So if this is too loose, it's going to slide over the malleoli, and it's not going to be very comfortable. So we have to take advantage of that anatomical position of the malleoli for that ankle hitch. Okay. Oh no, you're not going to be able to do that with the real thing. Okay. Now what you may do as well is include some additional pad. So this is an improvised, just using a t-shirt, but on the ambulance what I would throw is like an abdominal pad, a piece of absorbent dressing used for wound management, and that's perfect for wrapping around the ankle prior to applying this ankle hitch. So just for speed's sake, go ahead and look that up. We had to do any of these kind of things with a real patient, this kind of movement, it would take a coordinated effort on the person providing the manual stabilization and the person providing manual traction. And I keep repeating that, using those two words, so that you understand the difference, because that is a key step, providing that manual stabilization. what's going to happen next? We've got the ankle hitch on. So we have this ischial strap. That's also a component part for all of them. Okay? The ischium, this part of the pelvic girdle, typically provides a strap that comes underneath the groin. And so, again, working as a team, lifting up the leg. So imagine that team is lifting up the leg, and we get everything into position here. Ischial strap is secured. Then we have our ratcheting system on this. There's a pin that comes. We've got the ankle hitch. Buckle here. Okay. So the textbook says no more than 10% of it. Keep sitting up. Okay. No more than 10% of a patient's body weight, or no more than 15 pounds. Now, when we actually, with the mechanical devices, are providing that mechanical traction, don't do it too tight because you're pulling against an intact femur. So what do you think the give is going to be? No, it's in our practice sessions, it's going to happen down here at the ankle hitch, and the ankle hitch is going to get pulled down on top of the foot. So in our practice sessions, because we're pulling against an intact femur, just go ahead and snug it. That's all you need to do. Because if you keep on cranking it, thinking it's 10% of the patient's body weight, all you're doing is pulling against an intact femur, and it's going to pull this ankle hitch down. Okay. So meanwhile, the person's still stabilizing. Then we've got a variety of straps. Secure everything. Together. Okay. And then something that I like to offer, this is from practical experience, is that this keeps everything in line, but there could still be some external rotation. Patient, that is going to be extremely painful. So with this, what you can do is go ahead and get triangular bandage, and then tie everything together and see how that foot kind of rotated internally, because you can imagine that bone is completely cut. If there's that freedom of movement of externally rotating, how painful that's going to be. So that's why this is an important component part. Okay, and then I go ahead and reassess CSMs at the end. So that's called the hair traction split. Any questions on its application?
Is that really compatible with the backboard?
With the backboard?
Like, can you take out that stand on the bottom?
The idea is no. Typically that backboard is going to go into onto the cot or into litter. Okay. So that this would rest on a portion of the cot. Okay, so there would be a little bit of a drop, but this is maintaining the elevation so the leg is not resting straight on the ground, is what the idea is with this. Okay? Yes?
You use that triangular wrap to tie the feet together. Having your foot go internally like that, is that also not also bad? Not as bad?
It's minimal. It's minimal compared to that. Okay? Not good. Okay? This one even has a specific strap just to do this. Okay? But typically they get lost in the process and people completely forget about that part of the intervention. Okay? Questions on the hair. Now what we're going to do is we're going to demonstrate all of these, And then we're going to move on to the next topic, and then at our next skills practice, you have to be able to, you'll be tested on this one, or that one. And then in our scenarios, our wilderness scenarios, you'll have patients in which you'll have to fabricate the ones that I demonstrated. Okay? So good? You can take a nap now if you want. Okay, another volunteer.